Good morning, everyone, and welcome to our webinar. Again, this is Courtney, the Marketing Coordinator here at AIM. Today's webinar will be recorded and then later posted on our website, which does mean that all attendees will be automatically muted so that we can get a quality recording. If you do have any questions, go ahead and put them into the chat box and we'll try to have them answered throughout the webinar. But in case we do not have time, we will have a member of our team reach out to you after. Our next upcoming webinar is next Wednesday, February 22nd at 9 a.m. Pacific, and it will be presented by Don Erickson and GTL's Greg Esposito, going over GTL's new products, their Recover Cash, short-term care product, and their Turbo Term. So with that, I will go ahead and hand it over to Mike so that we can get started. Go ahead and take it away, Mike.
Thanks, Courtney. Morning, everybody. I appreciate y'all making time available here. And we're really happy to have Brian Welch. He's sales director for CSG. We had a last-minute personnel move that we had to make based on need, and Brian was more than glad to join us. And we are going to very shortly here turn this over to him and let him run you through this tool. One of the things that has been really good and that we really like about our affiliation with Integrity Marketing is they are heavily focused on technology and heavily focused on the kind of technology that makes it easier for agents to help the end user, which are agent clients. And one of the things that they make available within the scope of that idea is this the CSG actuarial suite of tools and such. So I'm going to get out of the way here so that Brian can take everybody through this piece. A lot of exciting upgrades and changes with this that he's going to talk about, and I'm sure for all of you, this is the kind of thing that will be very beneficial as you make your way through 2023 and prep for, heaven forbid to say this, AEP in the fall of this year. So Brian, take it away.
Perfect. Thanks, Mike. Again, my name is Brian Welch. I'm with CSG Actuarial. We are an integrity-owned company and work with a lot of the technology and quoting and enrollment tools that some of you agents may be familiar with, and there's some of you new agents on here that this is kind of brand new to them. But this is offered free to you, so there's no cost associated with this for you, the agent. And we're going to kind of go over all the different steps for quoting and enrollment and the different capabilities that you have through the tool. The screen that you see here is the main page that you're going to get to when you get logged into the platform. It'll say welcome back in your name, and you could do a number of things from this main page. The first is you can start running a quote, which is what we'll do here on this demo, and we quote 5 different product lines: MedSup, Medicare Advantage, Final Expense, and Hospital Indemnity. And so we'll go through those tools and kind of show you how to run a quote and the information that's presented there. But also you can edit your account. So you can go to that My Account page there. And if you want to change your password, if you want to update your information, you want to put your phone number and your contact information in there, that My Account button is also available. And then we have a contact support feature. So if you get stuck, you're having problems, something doesn't make sense on the tool, whatever type of support that you need, you can click this contact support button and can either give us a call to provide a phone number or to submit a support ticket, which then gets emailed in and responded to within 24 hours of whatever your question or issue may be. Also from this screen, we have our demo videos as it relates to e-applications. And so that's a major feature with the tool that we'll discuss. But if you ever need to go through an additional training piece or you wanted to see a really in-depth start to finish process, we provide both our Medicare Supplement and our Medicare Advantage e-app tutorials. And we outline the different MedSup and Medicare Advantage and dental, vision, and hearing enrollments that we have. And so we don't have enrollments for every carrier, but we are adding more each month. And so this will update as we add more carriers in. But without further ado, we'll get started. We'll start with Medicare Supplement. Just to start, you simply just click Run Quote, and every quoting tool works exactly the same. It brings you to a demographics box that is needed to enter beneficiaries' information so that we provide you an accurate quote. So we'll type in a zip code, an age, a gender, a tobacco status, and a plan. We'll default to G, it being the most popular plan, but if you click the drop down, you can select the different high deductibles or A plans or F plans or M plans or whatever plan you wanted to be able to select. You can do so there. We also allow you to add in the household discounts if that's applicable to your beneficiary, and choose future effective dates. So maybe you want to run a 4/1 or a 5/1 quote. That's very important to do. Many of these companies are changing rates year round. And so if your beneficiary is going to be enrolling, say, an April 1st date, you're going to want to make sure you move that effective date in case that company is moving rates between now and April 1st. You want to be able to capture that new rate when doing the quote. I can go ahead and run this quote here as it stands today, or I can click on this Show Advanced button. And this is only going to be for people that are going through an underwritten application. If it's GI or open enrollment, this is not going to apply, and it's not required, obviously, to run the quote. But this is where you can enter in different health conditions or medications based upon the beneficiary's health history, and it will filter results that will be accepting of that individual based upon their health history. So it's kind of a pre-underwriting tool before you would get to an application process. But again, that's optional and not needed. It's not going to affect the rate or adjust the rates at all. It's just a yes or no, approve or deny type filter. So go ahead and press Get Quote. This will quote any zip code in the country for every state. So it will work for across the country, and will provide the results cheapest to most expensive. So you can see here above, it's giving me my quick quote box. So if I wanted to adjust the zip or the age or the gender or the plan, I don't have to keep clicking back and forth to make those adjustments. I can make them right here on the page itself. If I do want to start brand new and fresh, there's a new button up here in the right-hand corner where I can click new, and it'll take me back to the screen we're just on. But as I said, it's going to price these out cheapest and most expensive. Give me the price per month in the company, as well as if there's a household discount and policy fee. If one or both of those don't apply, this will be blank. It'll be missing that information. That's not an error. That's just not applicable to that company. This policy fee is not included in this rate. It's a one-time fee. So you're just seeing the base monthly rate associated with the demographics that you typed in. We'll also give you some basic company level information, like effective date of the rate, years in the market, if they have an AM Best rating, the rating class. Many of these companies have different rating tiers associated with their rates. And so we'll label what rating class this rate is tied to, which is important to distinguish when you're going through the quotes, that you're making sure that based upon the rating class, is this rate applicable for my client? And then rate type, whether it's an attained age, issue age, or community rated policy. Beyond that, we have a few other options. First is quote options here. From here, you can either visit the carrier's website where you can log in and authenticate yourself as the agent, or you can click view plan details, which is all the benefits associated with the plan that you're looking at. Beyond that, we have our left-hand side toolbar option. First is going to be compare quotes. So let's say I want to compare a couple of these plans side by side and don't want to look at the full list. I can click the company names and they turn green. By clicking the company names and turning them green, they're going to be shown up here up above. And I can click compare quotes and just put those two plans side by side on the page. And so if I wanted to just send these two plans to the beneficiary, either via email or I'm screen sharing with them, we want to segment out certain plans, that's a good way to do that. To take that off, I just click the company names again, and it goes back to the red color. We also have export options. So you have your blue print button. If you want to print this off, it puts a printer-friendly format. You can print the quotes off, take them to a meeting, or if you're going to go meet them in person. We have our red export button. So if you need to email these clients the rates, you can export this to PDF and it'll export exactly what's shown on the screen. Or for those Excel-centric agents, you can export this into Excel and use it in an Excel database. Below that is in our just or view options. First is expanded or contracted view. If you'd rather see a simpler view of the rates rather than more of a expanded view, you didn't want to confuse your clients, you just wanted to show the price and the company, you can do that there. Next one down is the apply discounts button. And you can see here when I click that on, the rates adjust and the order of the companies adjust. That's because it's applying that 7 or 12 or 15 or 20 or whatever percent for the household discount is. It's applying that and doing the math for you as the agent. Next one's annual rate versus monthly, pretty self-explanatory. Fourth one is the most robust, and that is our market analytics. And this is going to cover 3 different topics. First is age increase data. So this is only applicable to attained age policies or policies that go up each year the insured gets older. If it's issue age or community rated, which don't work that way, this will be blank. So again, not an error. If it's issue age or community rated, this is not applicable, but it'll show you each year the insured gets older what they'll pay in future years. So this person would pay $96.35 today. Allstate Health Solutions will raise that rate 6.1% when they turn 67, and so forth. We also have increase history. This is when the company has gone back and filed new rates with that state and plan, the date that those went into effect, and the percent of change. Allstate in Nebraska filed a 5% decrease on their Plan G for effective 8/1/2022. And so this just gives you how they've handled previous increases. This goes back to 2015. Many companies won't go back that far because they're new in the state, they're new carrier to the market in general, or they've introduced new paper or new company that they're writing that plan under, and therefore they have limited increase history. Some of the blues, United Healthcare, you'll see increase histories that'll go back that far, but a lot of companies will have limited view, and again, that's not an error, that's just based upon those factors I just described. And then lastly is market data, which is NEIC data. This is financial data that's updated once a year. The companies self-report this information at the end of each year. So you're looking at 2021. The year 2022, which just finished, will get updated in April. So the carriers have until April to file this financial data to the commission. Commission provides it to us, and we provide total lives insured, earned premium, loss ratios, or what they're paying out in claims, and market share. We do that both for the state that you're looking at, that you ran the quote for, and the national level. And you can see previous years by clicking this button to see how they've grown or decreased in terms of their overall size. The reason we include all this is it's not information that every beneficiary is interested in. It's not always something they're going to use every day when running quotes, but we really view this as a market advisor tool, not just a quoting tool, something that any question you would get from a beneficiary, you can answer while using this service. So that's market analytics. Next one down, select plans. Not very popular and not offered in a lot of states, but if you do want, or your beneficiary is interested in select options, you want to click that select plans button, and select plans will display. Again, not very popular. Most companies don't offer them. If you click it and nothing shows up, that's not out of the ordinary. They're very limited in their scope. And then lastly, the underwriting filters. If you wanted to talk, if we had entered drugs and health conditions on the previous screen, if you remember from that show advanced button, and we wanted to toggle between the filtered and unfiltered view, you can use this toggle to do that back and forth. That's quoting from EdSup. We also have enrollments. And so for certain carriers, you'll see this apply now button, and we're adding more carriers each month. So rather than having to leave, go to the carrier, log in as the agent, requote the individual, and then do the enrollment, we've closed the loop for you. So when you click this apply now button, it's going to ask for the NPN and writing number that you use for that carrier, and we authenticate you in real time, making sure that you're properly appointed and licensed with that carrier, and that you're appointed in the state that you're trying to submit the app for. So when you click apply now, that's what it'll ask you. Once you've entered that information, it's going to populate a screen that looks like this. And it's now ported us into the application itself. And so what it's done is it's carried over the price, the gender, the age, and the tobacco status that we've entered on the previous screen. And it's loaded in all the different sections for this application. And I can do these in any order that I want, and all the information or the language that's used in the app is the exact questions and language that's used in a paper app or their own enrollment system. So it matches exactly. We provide green checkboxes for sections that are done in good standing, meaning all the information is filled out and the information that's provided is valid, or yellow exclamation points, meaning you're missing sections, or depending how you answered certain questions, the app's going to decline, and it's warning you as the agent that this app's going to be declined and won't let you submit it through. And so as you go through and complete these applications, you can then have the beneficiary sign it either in person, security signature, or DocuSign via email, and it saves then to your account here by going back to our dashboard screen. Go back here. It's going to have this e-applications tab, and when we click on View Active, it'll give you your statuses. So it'll say the company, the applicant's name, and the status, whether it's incomplete, meaning you've started the app and haven't completed it, you've submitted it and it's pending approval, or it's approved and submitted. And if that's the case, it'll provide you the policy number associated with that application. So in the event that you needed to go back and check a status, you needed to use that policy number to contact the company in reference to the application, whatever the case may be, this is where you'll find your status reports of all the applications that you've started or submitted into the system. That's MedSup. We'll now go into Medicare Advantage. And by doing that, we'll click on Medicare Advantage version 2. You'll see there's a version 1 on here. This is an old version that we're going to be sunsetting. Version 2 will allow you to enter in drugs and pharmacies, which is the difference between the two. Same thing as before. Zip code, age, gender, and tobacco status are not needed here to quote accurately, but a couple of different selections. The first is we'll quote Medicare Advantage, also Part D, and special needs plans. So if you wanted to quote those different options, you can select those there. Effective year, it's not important other than during AEP. If you wanted to quote, say, this upcoming AEP, a 2023 or a 2024 option, you can make those selections there, but it will default to the most current year. We also have different sort bys, right? We're on MedSup and other products, we're just sorting by cost. Here, you can sort by premium, but you can also sort by different copays or deductibles if you wanted to look at the results in that way. You can go ahead and run this search without drugs, or I can choose to add drugs into the quotes. If I choose to do that, I would need to select my fill method, either retail pharmacy or mail order. And then I can begin to add drugs and pharmacies. So when I click add prescription drug, it's going to bring up a modal. I'll type in a drug here. It's going to begin to try to guess what I'm trying to type in. Select my drug. I can allow generics or substitutes. I can select my dosages, my packages if available, quantity and frequency, and I can add as many drugs as I want. I can add 50 if I would like. Add the drug. Then loaded all the drugs in that I've added here, and I can edit those or remove those if need be. When I click Add Pharmacies, it's going to pull back the zip code that I used within the quote, and it's going to pull back the pharmacies either a 10, 20, or 50-mile radius, and I can select those either by searching the pharmacy name, scrolling through, or using the map to best select the pharmacy that I want to do. And again, you can select as many as you want and click Add. So now I've got my demographics, my drugs, and my pharmacies all entered for this quote. I press Get Quote. I've done that for us here. It's now resulted in the output. It looks very similar to what we did on MedSup. It's going to give you some base level company information like health out of pocket, drug premium based upon the drugs that I entered, and which drugs and pharmacies are covered under this plan. I can also enroll. Works the same way as MedSup did. Click enroll. You enter your MPN, your writing number associated with that carrier. It validates you, and you submit the application associated right here on this tool. From here, I can do a number of different things. One is I can click Show Plan Highlights, and this is really going to cover a number of different things, some high-level plans associated with it, like drug deductibles, copays, Part B reductions, pharmacy information, and then my drug tiers, some base level information that most beneficiaries or agents are interested in. Or I can click on View Plan Details, and this is going to get me to the actual nitty-gritty of this plan. populate 4 different tabs. The first is overview, so just some base level information that we saw on the previous page. Benefits and costs. This is the actual, all the benefits and co-pays and co-insurances and deductibles of every benefit that comes with this plan. My drug coverages, so based upon the drugs that I entered, it's going to give me my selected drugs, what my cost before and after an in-gap coverage and after gap coverage cost will be by both the pharmacies I selected and mail order, if I chose to run it with mail order, and then my estimated drug cost per month, and can find where the donut holes would be and so forth. Similar to what you would see on a Medicare.gov site. Also with Medicare Advantage is we do have this fill in the gaps feature here. So this allows you to run a a Medicare Advantage and a hospital indemnity plan side by side right on the same screen. This is very popular from a cross-selling standpoint. So when you click fill in the gaps, it's going to carry over the zip that we used for the previous quote. I can then select my age, gender, and tobacco status, not needed for the Medicare Advantage quote, but needed for the hospital indemnity options. We'll click search quotes. What the system is doing now is it's trying to find all the different hospital indemnity plans that will be available to my client. It's now provided in a list, and we'll just select this Medico 3-day plan as an example. I can select more if I want to, but we'll do Medico 3 days, and we'll click add to comparison. What this is doing now is it's showing me on the left-hand side the Humana option that I clicked on, and then the Medico option that I selected. And so all the different benefits associated with the MA plan and then the hospital indemnity plan, I can begin to increase the benefits. So this pays $425 a day for days 1 through 5 and 0 per days 6 through 90. I may want to fill in this gap, which is where the fill in the gaps label comes from. And maybe I want to add in another $175 a day to fill in that gap for an extra $6.33, which then adds up to total cost above. Maybe this benefit doesn't come with emergency care, and this one does. Or the ambulance benefit's a $290 copay, and I want to cover that copay or increase the benefit for $250 a day for $3.38. So you can really build a better option for your client where the Medicare Advantage plan falls short. You can, again, fill in that gaps with this hospital indemnity option using this fill in the gaps tool, and it adds it all up for you. You can export this into a PDF or print this off if you wanted to present that to a beneficiary at your choosing. Medicare Advantage. We'll now go back and do final expense. You could also run Medicare Advantage by itself. It works the exact same way as what we did before. Maybe I'll show you that here. So if I want to run just a standalone hospital indemnity plan, again, zip code, age, gender, tobacco status, same as it was on MedSup, and I press get quote. It's going to quote just like the other plans did, but again, just for HI. A unique thing with this is it's going to quote you the base plan options. So you can see for Chesapeake Life, the base plan is $50 for 3-day options, and the included benefits are inpatient mental health and observation benefit. In the event that I wanted to increase the benefit amounts or add riders, we'll go into that quote options tab we went over on MedSup, where we can click the plan details to view the benefits. Same concept. We click view plan details. It's going to take me to a benefits screen where I can begin to increase the cost. So rather than $50 a day, maybe I want $400. That's $25. Maybe I want to add in an ambulance benefit of $200 for occurrence. That's $3.53. This is where you can go in and build the plan in the event you're just looking at HI rather than that fill in the gaps feature. And again, this is exported by using our export options, which are always up in the right-hand corner on these screens. Also, your export options over here, your compare features, your expanded and contracted view, everything that was on the previous screens that we had covered is going to be here. We really try to make it that if you can run a quote in one tool, you can run them in them all. We try to make it as easy and as congruent as possible. The last quoting tool we have is Final Expense. This is going to work a little bit differently than the health options, where zip code, age, gender, and tobacco status are still applicable. But here we can select a face amount, or a monthly rate. Say your beneficiary can afford $50 a month. It'll pull the corresponding companies and face amounts that are available for the $50 a month. You can't run them both. That's why they're gray out when you click on one or the other, because one doesn't always equal the other and you could get no results. So we force you to select one or the other. Product type, we default to level benefit, but if you wanted to run return of premium or modified or graded benefits, you certainly can. And if you wanted to run underwritten or GI options, you can use those selections there. Before we run this quote, I'm going to make a mention of this client application client name feature. This is applicable on all of our quoting tools that you may have seen when we went over the previous options. This is if you wanted to pull a client in that you've already created. And I can create clients by using our client manager, which I'll discuss here after we go through final expense. But what this will do is when I click on a client, it's going to drag over their information that I've already entered in. So rather than having to re-enter the zip code or the age or the gender or the tobacco status, by selecting a client, it's pre-populated information that the system already knows about this applicant or individual. And again, I'll show you that client manager here in a second, but I just wanted to show you that that's part of the quoting process. Press Get Quote. Same as before, a little redundant, cheapest to most expensive. It's going to look very similar to the other tools that we've already gone over. And again, this will quote 100% of all the states and all the zip codes. Your quick quote section is still here. Your compare feature is still here, as we went over before. Your export options, expanded and contracted view. A couple unique things with final expense. The first is the supply fees. Each of these companies have an annual fee associated with the rate. You can include that in the rates by clicking Apply Fees, and the pricing is going to adjust. Other than just monthly or annual, quarterly and semi-annual are also here. We know that those are popular with final expense options, and so we have those available in the event that you wanted to look at a quarterly or semi-annual rate option. But pretty self-explanatory: price, company, ratings, rating classes, what type of plan this is. If they have different names for the different plans that they have, we will put that in there, and if it's an underwritten or GI option. So that's the quoting and enrollment functionality. I'll talk about some other things on here that aren't quoting and enrollment before we open it up for questions. One is the ESOA tool. And so what this will do is allow you to fill out a scope right here on the platform rather than having to do a paper scope with the beneficiary. So when you want to do that, you just click on View List under ESOA Document Signing. And what this is going to bring up is it's going to have previous scopes that you've started and haven't finished, or you can click on Start Document to start a brand new one. So we'll click Start Document. This is CMS approved and compliant. And so I'll show you that screen there to make sure that you're acknowledging that. We'll title the document just as AIM Test. You can put this as the beneficiary's name or whatever you want to title the document as. Click Save and Continue. Like I was saying, this is CMS approved and filed. So these are the terms and conditions and consents that CMS requires associated with an electronic scope signing platform. You as the agent would just need to scroll down to the bottom and click I agree and continue. From here, we can do two things. I can either do this if I'm in the same physical location as the client. I can click yes and go ahead and just do the scope right here with the client. Or I can click no, and I can email this DocuSign signature to their email. And if I do that and press continue, it's going to tell you as the agent, this has now been sent to the applicant's email. We will email you back when the client has signed the app. And when you click back to documents, you'll see here that this is now pending and awaiting signature. Once it's signed, it'll remove from this screen, and we'll go back to our dashboard page here and go into our document locker. This is the document page where all of your scopes are stored. And so we back this up every night. You don't have to worry about losing it, but that's this piece here. And so when you click on View Files, this will populate all the scopes associated with the tools or the scopes that you've completed. And you can load in previous scopes that you've done. So if you have a big folder on your computer where you want to load in all your old scopes, you can do that here by clicking on this upload button to drag in files. But here's where they'll be saved, and I can either preview or download the scopes in the event that I needed them for some reason. And this is what those look like. It'll provide same kind of scope file that you've seen before with electronic signatures and timestamps, again, that are saved to your account. Lastly, for the tools that we have, the last one is the Client Manager. I mentioned that piece when we were running the quote where you can click the drop down and select certain clients. Under the Client Manager, this is where you can house leads, existing clients, and so forth under the tool. And it'll save quote histories, their current plans, their demographic information, everything that you have done with this client previously, it'll save under their account. I can create new clients by clicking this new button and entering them one at a time. Or if you have a large list of clients or leads that you want to work and be able to save all the information like their drugs, their pharmacies, their apps, and so forth, I can then import a large list of clients into this platform that'll upload, hundreds of clients at one time. In the event that you wanted to know what this file needs to look like or format, we have a training guides button up here in the right-hand corner. When you click that, it'll provide a tutorial on how to load that in and a client import example of exactly what that file needs to be formatted like to properly load your clients in. But once you've created the clients and loaded those in, we can select the client here. And what this is doing is it's going to show me, obviously, first and last name, date of birth, social number, title, phone number, address, email address, and then it's going to have my quote history, drugs saved, applications done. This is kind of a CRM component. That's why we call it the Client Manager component of the tools, so that you don't have to keep handling the clients from a fresh start each time. That's Client Manager. A few other things to discuss before we open it up for questions or anything that anybody wants me to go over. Again, this is mobile friendly. So anybody that wants to access this through their phone, through their tablet, anywhere you have an internet connection, you can get access to this tool. And so it will conform to the different screen sizes and so forth. But again, you need an internet connection in order to get access to this. This is also good for 5 concurrent logins. So if you have a business partner, or you and an office assistant, or you want to be logged in under your phone, your tablet, and your computer, it allows 5 concurrent logins at one time, so you can be in it at multiple places. Beyond that, I wanted to keep it to about a half hour, 40 minutes before we open it up for questions, and we're about there. So I'll kind of pause to see if there are any chatted questions or questions that people want to ask associated with the tools.
Thank you, Brian, so far. So the one question that we've seen so far is how well protected will the client information be on this platform?
Sure, good question. So we had to go through what they call a SOC 2 audit and authentication and certificate in order to do the enrollment and client manager option. So we are meeting what would be considered the industry standards for that type of information, the same type of standards that carriers also have to go through when they're storing their own client and beneficiary information. Same type of certification, but we are certified to do this type of and store this type of information.
Well, perfect. That's great to know. It does not look like we have any other questions at this time. So I want to thank you for your time this morning going over this fantastic platform with our agents. So this webinar will be recorded and put onto our website later this afternoon for anybody who wants to go back and take another look at it. If you do have any questions until then, go ahead and give us a call at 800-672-7202. Thank you all for your time this morning and have a great rest of your day.